An influenza outbreak has gripped the United States. At least about 11 million people have contracted flu. 5,000 people have ended up losing their lives. At this juncture, a decision by the U.S. government has taken everyone by surprise. The U.S. Department of Health and Human Services has reduced the number of vaccines recommended for all children. While universal immunization catered to about 16 diseases earlier, only about 11 diseases will be covered for now. Vaccines for hepatitis A, hepatitis B, rotavirus, meningococcal disease and influenza are now optional. Patients can take them after consulting their doctors, and it is worth noting that the COVID-19 vaccine was already made optional last year. Now, reacting to this, the American President Donald Trump claimed that the new childhood vaccination list is rooted in the gold standard of science. The decision was taken by studying the vaccination pattern of 20 countries across Europe, Australia and Asia, and the Trump administration has reasoned that the US recommended more vaccines to children than any of these other nations. It concluded that the vaccines are not necessary in case of hepatitis A and meningococcal disease, owing to the low incidence rate of 0 to 1 per 100,000 people. As far as the rotavirus is concerned, the government claims it has found no risk of mortality. On the question of influenza, it has stressed that there is no evidence to show efficacy of the vaccine for hepatitis B. It stressed that a vaccine is essential only for high-risk groups. And this move has been flayed by medical experts. Dr. Robert Hopkins, the medical director at the National Foundation for Infectious Diseases, has opined that many vulnerable children will find it difficult to access the vaccines, which have been made optional. He also claimed that data and expert advice had been ignored. Meanwhile, the American Academy of Pediatrics has dubbed it a dangerous step.
It increases confusion, it increases doubt in the tools that we've had available to us to protect our children for decades. And that's going to cause more people to have doubt about what's the right thing to do to protect their children. And that's a catastrophe as well.
Now, the U.S. has claimed that excluded vaccines shall continue to be covered under insurance, but concerns remain over the confusion created by this decision and whether this can lead to an increase in preventable diseases. For all the latest news, download the WION app and subscribe to our YouTube channel.